I'm Dr. Karen Pardee and I'm a GP and the Community Director for Cardiff South West Cluster. We're really fortunate to have a range of excellent community organisations in our area who help us to support health and wellbeing through activities within the community. These promote physical exercise, healthy eating and mental health, as well as giving advice on social issues such as housing, benefits, employment and debt advice. As GPs, we want to do our best to help our patients in all aspects of their lives, which can impact on their health and well-being. The GPs in Cardiff South West Cluster aim to provide true holistic care for our patients, and we believe that strong links with our community through social prescribing will help us to achieve this.
What we've kind of found from our work in recovery services, some people who are coming through, with issues with kind of substance misuse and alcohol and coming into these recovery services are quite often at rock bottom, really. What this model kind of offers is saying, well, maybe they are ready to have the positive experience of spending a time credit up front. So the model kind of says, well, okay, what are your interests? What do you enjoy? What do you love? And maybe we can spend time credits on an activity that lines up with those interests. But what we would ask them to do then is pledge their time back afterwards. And that's where the kind of model comes full circle, paying my debt essentially. And what that really kind of encourages as well is a very kind of active participation. When you've actually pledged your time and you said, well, I'm going to go along to the support group, I'm going to help set up, I'm going to be a part of this, I'm going to help to run it because I've had time credits and now I need to earn them back. People are much more actively engaged and therefore tend to stay involved and are much more likely to get involved in the first place as well.
So we started using social prescribing with the local GPs because they really wanted to refer people to our projects. So one of the GPs actually suggested a prescription slip that would have sort of some of the most important projects listed. They could just tick the one they recommend, pass that to the patient, and the patient could then come to the activity. So some of the options on offer on our prescribing slip. There's mental health courses, so we deliver the stress control and action for living courses in partnership with PMHSS. We have an option for patients that need any help with debt, benefits, crisis, food bank provision, anything to do with money worries. We offer a range of volunteering opportunities in the community, so people who just would benefit from getting more active, getting out, meeting new people, feeling useful, feeling valued, all the benefits that volunteering can bring.
Wellbeing for You is an initiative that started in April 2016. We are currently based in 17 practices across Cardiff and the Vale. There are 8 trained coordinators that sit within the practice and local communities, and this enables the clinicians and practice staff to refer any of their patients that we're able to work with that person to identify what goals they may want to achieve in terms of lifestyle changes, behaviour changes. So helping them to navigate and signpost them into their local community to find the right resources that will help them make those changes and resolve those problems. So where we are able to help is direct people to places like Citizens Advice Bureau, care and repair for mainly people in isolation and elderly, so we're able to ensure that their homes are safe for them to continue to live in longer. By doing some of that work, we're hoping to keep those people away from secondary care in terms of keeping them safer in their own homes for longer and link them to places in the community where they can find friendship.
I'd been living abroad in Germany, I'd been in a relationship, so I had a broken relationship, then I had to return back to the UK. I found myself a little bit almost destitute really because I'd been out of the country. So what I needed to do is to engage with sort of some networks or whatever. I was greatly encouraged by that, because we had the one-to-one and offered then, further appointments, which was very good for me because it gave me a focus really. Lots of things have changed, my circumstances have changed. When I initially engaged with the Wellbeing, I was in a homeless hostel. Since then, I managed to keep focus, so my idea is I'd keep within the criteria of the hostel, and by doing that and engaging with the Wellbeing, I've actually moving into my own accommodation now, which is council run. I've engaged with the local church. Again, that was another sort of avenue for me to explore, to get in there. And what I do there now, so I volunteer on twice a week. That's again has kept me, given me some sort of structure to the day. As I said, it really has it's had a positive impact on my general well-being and helping me to keep focused.
The Grow Well project is currently delivered at the Lansdowne Surgery and at the Dusty Forge in Ely, and it provides a service to ensure that people within our community have community support, and they may come about that just by a love of wanting to garden or grow, but they may just be looking for company or to learn new skills or a supportive framework to spend some time in. We've had a broad variety of patients we've worked with, as well as self-referrals, from people with high levels of anxiety all the way through to people who are suffering low-level stress, perhaps issues with jobs or finance, and this provides them with a breathing space to take a step back and maybe just talk to like-minded people. We've seen a number of individuals now go out and find full-time work as a result, which is fantastic.